The problem of emergency room closures continues to be one of the biggest issues in PEI, and it was top of mind at Health PEI's AGM at scenic Brudenell River Resort on June 28th. The lack of doctors and nurses has forced the ERs to close repeatedly at Western Hospital in Alberton and at Kings County Memorial Hospital in Montague. It has also forced the closure of the ICU at Prince County Hospital in Summerside. Diane Griffin, the new board chair with Health PEI, said improvements in the healthcare system are being made, but it will take a while for Islanders to experience those benefits.
But the big shortage of staff is what's a real killer for Montague and for Western Hospital. And until we get more staff into the system, those hospitals are having a problem. And that is to keep their emergency room open during the normal operating hours. The goal of Health PEI is certainly to get those back into operation on a full-time basis so that they're open every day of the week.
That likely won't mean 24 hours a day. Griffin also addressed some recommendations her predecessor Derek Key made when he resigned last December. She doesn't necessarily agree that Health PEI needs to operate at arm's length from government, saying so much of the system runs on the provincial budget. But she does agree with Key that Health PEI needs to play a greater role in hiring healthcare workers.
Well, I think it should have a greater role than it has in the past, and I know there has been good discussion between representatives of the department and the Medical Society and Health PEI through Dr. Gardam. In fact, they're having a meeting tomorrow. And they're very much starting to work together in a much more collaborative way. They're all stakeholders in this, and they have to work together. We're too small to be everybody going off trying to do their own thing.
Dr. Michael Gardam, Health PEI's CEO, says the doctor and nurse shortage is a problem across Canada. Like Griffin, he said changes are being made in the system to make it more efficient, but it all comes down to recruitment and retention.
So we're becoming more efficient with the resources we have, but it's sort of like treading water. You can only do that for so long before the number of people overwhelm you. So the big thing for us is to be able to recruit, and that everybody's pulling out all the stops, trying to get people.
There were no announcements, no major magic solutions announced here at the Health PEI board meeting. But one thing is clear, the problems experienced right now by the Western Hospital, the Kings County Memorial Hospital, and even the Queen Elizabeth Hospital in Charlottetown remain top priorities. Reporting here at Brudenell Resort for SaltWire, I'm Dave Stewart.